Good morning and welcome to the webinar. My name is Lauren. I am the Educational Services Manager here at Alzheimer's Orange County, and I will be your host today. Thank you for joining us for Resistance versus Resiliency in Dementia Care. Today we will discuss the role of resilience in dementia care and why it is so important to all of those that work with individuals who have dementia. Today our presenter is Dr. Yuanjin Zhou, Assistant Professor at the Steve Hicks School of Social Work. Before we begin, a few reminders. Your mic and video are automatically disabled and will remain so throughout the presentation. However, since we will be asking for audience participation, please raise your hand and I will unmute you. Additionally, you can type your response in the chat box. Any questions you have for the presenter, please type into the chat box located in the taskbar. We will save your questions and answer them at the conclusion of the webinar. A copy of the PowerPoint has been emailed to you yesterday. If you did not receive it, please email me. I will put my answer in the chat box. Oh, I'm sorry, I will put my info in the chat box shortly. And lastly, we ask you please complete the survey at the end of the webinar, as it helps us to continuously improve our webinars and let us know what you would like to learn about in the future. So now I will introduce our speaker. Dr. Zhou is an assistant professor at the Steve Hicks School of Social Work. Dr. Zhou's research focused on developing measures and interventions to empower family and friend care partners to manage health and well-being for themselves and people living with Alzheimer's disease and related dementias. Her expertise is in developing interventions to engage care partners, to manage fall risk for older people, and developing interventions to cultivate and strengthen care partners' resilience. Dr. Zhou, I will now hand it over to you.
Thank you so much, Lauren, for your introductions. And thank you. I'm very excited to be here. I can see all your name here. And I'm looking forward to talk with you throughout today's presentations. And I have no commercial relationships to disclose. And thank you, Lauren, for your introduction and a little bit more about me. So, and how I get into getting into the work related to dementia care partner resilience. So I started working with older adults since 2010 when I was a social work student. And during the process, I noticed that many older adults living with cognitive conditions. And one of the most challenging conditions is dementia. And I was struck by the challenges of caring for someone with dementia, but I also saw many care partners endure very challenging situations and persevere as much as they can to provide support to their loved ones. I found their efforts, resilience, and strengths are often get unnoticed and unsupported by our current care systems. So really inspired my interest in pursuing a PhD and trying to understand these positive aspects of caregiving beyond the challenges and care burden. So this is what my current work is. We focus on understanding positive aspects of caregiving and how we can really develop programs and services that can enhance those positive aspects of caregiving and not just providing services when people are in crisis. So I found resilience is really an important positive aspects of caregiving, which I'm going to focus today. So here is the outline of today's webinar. I would like to share my thoughts about and my work and my talk and discussions with dementia care partners. It's not necessarily a training or workshops, but really to share those findings with you and lesson that I learned. I would love to hear any feedback and input from you all. Do you think this is resonating with you? Do you find this can be some of the things we talk about today might be helpful that you haven't thought of before? And we'll talk some key takeaways based on what I think might be helpful moving forward. And these studies is not done by myself alone because dementia is such a complicated condition and caregiving is very complicated. So we have a group of researchers and students working together. I would like to mention them here. And the research is funded by National Institute of Health. Okay, so first, why is resilience important for dementia care partners? I believe you may have heard or learned from your own experiences that care partner, family and friends care partners of people with dementia have to handle many things every day. They provide so much direct care, care coordinations, and health management for people living with dementia. And these efforts can make a very positive impact on people with dementia as well as themselves. However, there are also many studies, and we learned that caregiving can be very taxing and it might be negatively affect the health and well-being of care partner. When care partners are not well, we know that people living with dementia suffer at the same time. So because of that, current services for dementia care partners really target on stress and burden caused by caregiving. These supports are really important for care partner during difficult time. However, there are limitations of those efforts. When care partner access these services, they are often reaching a crisis point. And their services also tend to be some short-term relief, such as respite care or brief counseling. This approach may have limited effects in preventing or relieving this long-term care burden associated with dementia caregiving. So there's a growing interest. Think about what if we can make care partner more resilient, can we help them to support them during this very long and challenging journey? So what is resilience? Resilience is a concept that focuses on care partners' strengths and ability to recover from stressful situations. There are studies show that care partners who demonstrate more resilience may be less likely to experience this negative impact of caregiving. Therefore, resilience could be a new intervention target for us to take early actions to support care partners early on. In that way, we might be able to prevent them from various negative impacts of caregiving, and rather than addressing them when it is too late. However, it is hard to describe what is resilience, and especially hard to describe what resilience is for dementia care partners. How can we tell who is resilient and who is not? And if we don't know what that is, how can we enhance resilience in dementia care partners? In general populations, resilience sometimes means being perseverant and focused on problem solving. But some care partners share that when care partners ask that what they felt about this resilience, they found it problematic. Some care partners report that being perseverant and focused on problem solving can make them burn out in the end and make it hard for them to receive support because they feel they can do this alone, and they are good at it. But when they realize they need support, it's often too late. So working with care partner over the years, I feel being a caregiver may require very different things to be resilient. So then I started working on this issue 7 years ago, and today I will share with you what I have learned from scientific literature and care partners' life stories. Okay, here is a question for you. I would love if someone would like to share. So when you hear about resilience and you're interested in this topic and join the webinar today, what does resilience in dementia caregiving means to you? If you want to share something, you can put it in the chat or just raise your hand. Okay, Tina said to be able to rise up despite challenges. Thank you. Ability to engage in some self-care. Yes, you will hear me talk about self-care a lot. Yes, we want to talk about bounce back. What kind of things can help us bounce back? Yes, not feeling overwhelmed, not giving up, and self-care. Thank you so much for sharing your initial thoughts. Yeah, adapt to new circumstances. Yes, there's always something new happening, and we know this is a long journey. A lot of things are changing. To have the tendencies to move forward with care. Yes, we have to keep going. We have to move forward, and in our caregiving journeys. Thank you. To stay strong. Yes. Asking help. Okay, I think with all your help, we finished our presentation today. Okay, I hope I have something more to share with you. So I started with a lot of wonderings about what resilience means. So does it mean only center people can do all the things you just talked about? Does it mean only center care partner can be resilient, others can't? oh, that won't be helpful, because then I don't know how we can make how we can really support people to be more resilient. But does it mean care partners who report no stress and care burden are resilient? I also found that might not be. I kind of think about some care partner that I have met, that people, they might have challenges to committed to the care, or they have some histories and they decided not to care about the person living with dementia. They might be they might experience this they might not experience a lot of stress and care burden. But is this what we want? I also find that not kind of the resilient care partner that I'm thinking about. So with this question in mind, I did a thorough review of existing literature, just to see how everybody talk about resilience and what the resilience is for dementia care partners. So I found resilience is not just an individual personality or in personal traits, or it's just or lack of negative outcomes. Resilience is more like a journey. It is a journey, a process through which care partner utilize different personal traits and resources in the environment to address the challenges in the context of dementia caregiving. And hopefully it will resolve the adversity and challenges they encountered. And furthermore, care partner also experiences the personal growth and development through this journey. I will break it down and tell you more about it. So first of all, care partner resilience emerged when care partner faced those challenges and adversity in dementia caregivings. If dementia care partner decided to walk away or avoid all these challenges, resilience might not be at the resilience might not emerge during that context. And here are some common challenges care partner experiences and reports, and you might find them very familiar. So there are challenges associated with complex health and care needs. There are challenges to navigate informal and formal care systems. There's a challenge of balancing your care responsibilities with your other needs and responsibilities. And you have to managing your own difficult emotions throughout this journey, and many more. So what does resilient process look like for them when they addressing all these challenges? What care partner can do to overcome these challenges? I decided to choose an approach instead of me telling them what would be helpful. I asked care partner themselves, who recently experienced a crisis, and share with us how they overcame the challenges during the crisis, how it turned out, how that happened for them. So I collected all their stories and look at the things they have done and they found helpful or not helpful, and then put it all together into a flavor of resilience, if I may call it, a flavor of resilience that I created. I believe it covered a main type of things care partner reported that can be relevant to overcome challenges. However, I might still miss something that is important to you. So please leave a comment or messages in the chat, so we will see some unique strategies that you have found helpful. So as someone mentioned earlier, it's about adapting new challenges. So of course, it is really important to be able to respond to the demands of different kind of problematic situations. And problem solving is very important. Care partner have to identify effective or adaptive solutions for a lot of problems. When you see unusual symptoms, you have to figure out what happened and what can you do. When a loved one started to refuse eating, you have to figure out creative ways to make sure they continue getting the nutrition they need. How, other than problem solving, we found some other possible ways to respond to problematic situations that care partner found very helpful. So some care partners share how important it is for them to not jump into problem solving or problem distancing, jump into solving the problem. They often observe the progression and the changes of the problem before making any decisions. For care partners who adopt those behaviors, we found them to be better aware about the needs of people with dementia and themselves, and they can then choose appropriate coping behaviors accordingly. In this case that I share with you, a care partner share, say initially I can get very overwhelmed by something, but I think over time I've learned to use that as a cue to say, okay, stop. This is the time that I need to stop doing the things and get it out a little bit so I can keep going on this journey. Another important behavior that help care partner to be resilient is called problem accepting behavior, especially when situations are so traumatic and difficult to handle. Be able to accepting the uncertainty and the limitations of caregiving, perceiving the distress and the challenges of crisis as a normal part of the process become essential for care partner to remain calm and focus on the things that they are able to do without getting overwhelmed by things they are out of the control. So these care partners share, I'm just waiting for the next shoe to fall. I've always been one to say, don't sweat on the small stuff. It's just don't stress about things that can't change. I mean, it is what it is. I think it's especially really important for dementia care. There are just so many things that's out of our control, despite of all our efforts and good intention. Moving on, we find a very unique aspect of resilience for care partners, which is very different from resilience when we talk about an individual capacity. It's called compassion-related behaviors. So these are the efforts care partners take to relieve other people's suffering or benefit another people's well-being. Compassion-related behavior, including self-sacrificing and relational compassion behaviors. Self-sacrificing. You must be surprised. Self-sacrificing will it impact care partner health and well-being negatively? How this is relevant to resilience? I have the same surprise, but care partner tell me different stories. In those difficult moments, their capacity to self-sacrifice is what make it possible for them to managing people with dementia crisis. And for some of them, self-sacrifice is also meaningful as they're able to take care of their loved one and take care of others' family. So they don't have to experience the sufferings to see people living with dementia in pain. I actually think this is really important for service providers to understand that, because I know a lot of clinicians really care about the care partner's health and well-being, but they will tell them, you need to do more self-care. But it might not be the reality care partner lives in. And also care can also be a self-sacrificing can be a concept that have very different meanings in different cultural groups. One care partner shared that they got furious when clinicians asked them to do more self-care when they have to sacrifice themselves at that moment to survive the crisis and care for the person they love. What is need to be done possibly is how we can recognize the values and contributions of this self-sacrificing behavior and mitigate the negative impact of them. And another type of compassion-related behavior care partner share with me is a lot of time they really cannot do many things to relieve the physical pain people with dementia experience. However, being able to be kind and loving to them, understanding their experiences, and relieving the pain of others in the families are really important for them during these difficult times. So this tells us it is really important to facilitate effective connections between people with dementia and the care partners, and also other people in the care network. There's a positive emotional connections and meaningful relationship can be very essential for everyone to continue the care in this journey. Many of you have mentioned about self-care. Yes, care partners share how important it is to do self-care, even in the crisis. Even it could be drinking water, could be having food, it could be have someone to take care of the loved one and take a shower. So those small things that they maintain and cultivate over the years become very important for them to survive the crisis times. And not just self-care, they also mention the importance of developing and maintaining meaningful social relationships and continue having support to maintain connectedness between themselves, others, and the sacred. These meaningful relationships could be even with people with memory loss. As dementia progress, You might have to recreate and build different kind of relationship with them, and to be able to have a meaningful interactions with your loved one become very important for you to go on, for people to go on this journey. And asking for help and seeking for help. You might have heard about this across and in your journey. I think there's a one thing that people often miss is the help receiving. Help seeking is hard, is tiring, it's a lot of work. So is there a way that we can make help more available, more accessible for care partners? This is what I want always to share with my community partners when they're developing service programs. How can we make the help more easy for care partner to receiving? And another very interesting behavior that strategies care partner share with me is help disengaging. We found this a little counterintuitive, but care partner tell us not all the helps available or offered is helpful. Care partner who are able to say no to the help that are detrimental to themselves or to the people with dementias show to be important to their health and feeling of control. So in this case, when the people with dementia was in hospitalized and this care partner have to take care of everything, and we asked why you're not asking for help during this time, and she said getting help sometimes can actually be more of a burden. If they came up to the hospital, I like to translate for them, and I have to, make them feel better because people with dementia, she looks awful. And she also shared with me how she would like to protect the dignity and the preferences of the person they care for, as she wouldn't want to show up like this in front of a lot of other friends and families. So this really tells us when we talk about resilience, it's important for care partner to say no to the things, to the help that is not helpful. I learned from another care partner, say, okay, allow yourself to fire your doctors if you found the support from them or the help from them is no longer is harmful or not useful for you. And also, it is really, whenever we do, it's important to include care partners' voices when we're developing any services. So we will not providing services that not only not unhelpful, but also can be harmful or cause extra burden to them. Finally, we found learning playing a key role in shaping those behavior in all other domains. This was a relief because it tells us not just you are not a born caregivers. You can learn to be more resilient. If you there are different places you can try, different places you can learn and practice in your everyday. Of course, it's really important to learn from others. So you are doing it because you're here today and hear from me, hear from the stories of other care partners. And another important thing is reflecting. Reflecting is kind of an effort for you to think about your previous actions, the situations that you have handled well, the things that you have tried and worked well in order to develop a better understanding about the situations and moving forward. So a lot of care partners share with us how they try different strategies. They think about what have worked in their specific situations and use all the strategies now. So be able to have some time for yourself, reflecting the things you have done works well, or even the things that you find challenging, and think about in the past what you have done have helped you, will help you to continue being resilient to dealing with new challenges. So resilience means care partner talk after care partner share with us what they have done. We ask about the outcome related to the challenges. Do you feel recovered from this crisis? Do you feel better now after everything? We also ask them what kind of personal growth and what kind of new insight you get from this journey. And those are all very important aspects of resilience. So for all the care partner we interview, we found they all adopted at least some of these behaviors. even people who did not feel recovered. So we have 4 care partners feel they're not recovered from this crisis. They also have tried some resilience behaviors. However, they might not miss, but they have missed some important resilience behaviors. For example, problem distancing behaviors, problem accepting behaviors, or they didn't do a lot of self-care or develop and maintaining meaningful relationships, or are reported more behaviors on learning and reflecting. So people who reported a fully recovery, as you can see here in the blue line, they're more likely to adopt different type of behaviors together. This has become a little bit more more numbers, but the important message I want to share is the importance of using different resilience related behaviors simultaneously. You might have done, everyone has some resilience, but it's important to think about, have I overemphasized on one thing? Did I miss anything that is important that can help me keep going? Another interesting thing is for people who adopt resilience behaviors, I have seen them adopt everything they can, tried everything they can to overcome the challenging situations, but they still feel partially recovered or not recovered. So I asked care partner, what happened? Why you still feel not recovered despite you tried everything? Then they shared with us all these unmet needs can persist despite being resilient. They experience this lack of information and knowledge on the subject matter, and they do not have accessible and appropriate services they're looking for. They do not have the capacity of places to do self-care. There's one care partner share with me how it is hard to even find a quiet room in a hospital to stay quiet a few minutes by herself. And some care partner have no one to share the care responsibility with. So in these cases, they are forced to be resilient, and then they feel stressed out after they tried everything, even overcome the crisis at that moment, but they still experiences all the tiredness and burden after that. So from this, you can see even for people who feel fully recovered, they still reported many unmet needs. And for care partner reported feeling not recovered, they reported more unmet needs. What does this tell us? Resilience is not enough. There are times we need to expand our resilience to resistance and advocacy. Care shouldn't be all on the shoulders of care partners, and many things need to happen in the care systems. This also tells care partner the importance of doing self-care and cultivate acceptance and help-seeking behaviors, because those are the things we need to ask help and support from the environment. And care partner can also try to find organizations and service providers that can work with you to change the systems. And service providers for service provider, I think it's especially important to pay attention to people's unmet needs. Despite them being a very resilient care partner, we sometimes see them doing really well, have tried everything, but it is important to check with them, what are the unmet needs that you're experiencing? What other things can make your life easier at this point? So here I want to share you a story, a case, so we can explore together what does Jason need to be more resilient in supporting his father. So Jason is a 28-year-old Black man, have been caring for his father, Chris, who was 80 for 4 years. Jason has other siblings, but they are busy with their stuff. Although Chris have been diagnosed with vascular dementia in the health records, Jason has never been told that his father had been diagnosed with dementia. He has seen his father behave in an uncharacteristic way during a trip to the emergency department for acute illness. Chris was diagnosed with a urinary tract infection and discharged home. Jason said the main challenges experienced was navigating the healthcare system, i.e. accessing services from a distance and communicating with healthcare providers about how to care for his dad, and managing his sadness and fear because of his dad's sudden and continuing deterioration. After we learned a little bit about different kinds of resilience behaviors, what do you think Chris could do to overcome I think here is Jason. Jason could do to overcome this challenging situation. I wonder if some of you can either share it in the chat or raise your hand. I'm going to go to the main challenge slide so you can think a little bit about, based on your experience, of what things Jason could do. Just give you a minute to think. Yes, contact his area agency, aging, and disability have tons of resources. Yes, the hospital social workers. Let's have one more. Yes. I see someone raise their hand. Miss Cassie. Connected with friends and family to share his feelings. Find a local support group. Yes. So the question, so here is not Chris, it should be Jason, because Jason is the son. So what do you think Jason could do to overcome the challenges? Ask for sibling support. Thank you so much for all your comments. I actually think it's really interesting because a lot of things you all suggested here, Jason didn't do. So let's see what he has done. So Jason first told us, I put my dad's care over everything else. I want to be strong for my family so others won't worry too much. So he put himself as a shield between his dad and the other families. And he trying to look for a closer service providers because it's very hard to reach out to service provider that is in a distance. And he did ask for help from service providers to managing the UTI at home that he has no experiences before. And in the moment that he feel overwhelmed, he went for a walk when feeling this is too much. And he prayed to God and talked to God about his fear. He was able to learn how to monitor and prevent UTI moving forward. And he also reflected on how his dad told him about uncertainty of life and death, and how he keep his lessons in mind and think about the lesson when he's dealing with his fear and sadness. So as you say, Jason shared how this behavior made him, all these things he have done made him feel recovered, and he feel he's a grown up after this. He feel that he had become a less selfish person through this journey, and he was able to take care of his family by not letting others worry too much. He took a lot of pride in being able to do this, not only for his dad, but also his other families. He feel recovered, but he still found it hard to accept father's decline. So this was another question I prepared for you, is what resilience-related behavior Jason didn't report. Actually, a lot of things that you shared here, he didn't do. He didn't join the caregiver support group. He didn't reach out for resources in area agency on aging. He didn't ask for help, the social workers in the hospital. He trying to find find a place that are closer to him, but he couldn't even find it. And he didn't look for support from siblings. As I said, he wanted to shield them from being sad and being in pain. Yes, some of them think how he overcame challenges in the past. So he didn't do a lot of things, but he did tried a lot of effort to overcome these challenges. So what kind of unmet needs may Jason still experiences? So we talk about the things he tried and the things that he didn't try. What do you think he might experience any unmet needs? Yes, ongoing caregiver burnout, because he trying to do everything alone. He wants to do it for his family. It's very important. And he has a difficult time. Yeah, his own personal health and well-being. Even he tried some self-care, but he hasn't always should get help. Yes, he seems to have challenges to get help for a variety of reasons. Not want to burden the siblings, and also not even able to get the help, like find accessible resources. Yes, some emotional challenges if he didn't really reach out to connect with siblings with that. Yes, and another thing that I mentioned in the beginning is actually the dementia diagnosis was a surprise to him, because even the dementia diagnosis was in the health records. He wasn't being told, and he wasn't being prepared. So he wasn't even know how to navigate this different kind of behavior symptoms when that happened. So he needs more information and knowledge moving forward. He needs more support accepting the decline, or think about following what that he needs when decline happened. And he does have siblings, but there's no one there right now to share the care responsibilities. So this is also help us to think about even a person who is very resilient and try different ways. There are so many other things that potentially that he can get more or do more for the future. Yes. So what do you think Jason could do moving forward to enhance their resilience? I think a lot of you share very good ideas. We can see he might need to be, if there's a service providers, he might really need more knowledge and information about dementia, especially vascular dementia, and how to navigate that at homes. And he might need to be connected with someone, thinking about what kind of services they will need as their father continue decline. Or is there any needs for him to managing the house management, managing the house symptoms of his father? And that's something that maybe he's motivated to do, right? He willing to learn about UTI and managing that. Maybe there's something else about the house that Jason can get support. And also having a conversation with the siblings. Maybe siblings are willing to help. Maybe there's something the siblings can do. But Jason needs to do something to make that connections and reach out for from the family. Yes. So this is really a little case to show what are the different things that we can do to enhance someone's resilience. When I go back to all the behaviors, we can see Jason has done so many of these things. So we can help them to adopt more of help him to do more of the house management. And we see he hasn't really developing and maintaining meaningful social relationship. Maybe we can ask Jason what kind of social relationship he already have. Is there someone that he feel trust that he can share his difficult feelings for? So this is really a map both for care partner ourselves and also for maybe for service providers to work with care partner to look at the things they have been doing really well and some of the things they might be able to do more um, to stay strong and to continue this journey to prevent burnout and also prevent crisis for people with dementia. Thank you so much for all your very active feedback and sharing your experiences. Here's really a little summaries about the steps to enhance resilience for dementia care partners. I think this is good for service providers and also for care partners ourselves. Steps 1 is to identify the challenges. What are the challenges they are really facing right now, and think about how they would like to, what are the things really impacting the care partner's life right now. And then reflect on what you have done to overcome these challenges. What are the things that he might have done and have worked really well? And examine how your efforts worked. If something have worked in the past, can you do more of it? If things hasn't been worked well, if you trying to be strong, but you feel very burdened, overwhelmed in the end, is there something you can do differently? And then don't forget to identify any unmet needs despite all your efforts. There are things you need to get. There's information, knowledge that you need to learn, with support that you need to have, and even someone there to share this journey with you. And identify areas you want to improve. We all know Jason should reach out for support, but what things that Jason wants to do? What are the things Jason care about? So identify the areas that they want to improve and help them to developing some more, to adopt more of the resilience behaviors. It will help, and it may work more effectively because there are so many reasons for people to not do something. It is important for them to make the decision, to make the changes that is going to be helpful for them. So this is a little map that I make for you to go over, think about your challenges, things that you have already been doing, how has that worked for you, any unmet needs despite all this effort. Is there anything that could help you? And identify areas that you want to improve. You might not be able to adopt all this new behavior all at once. Think about what might be the things you want to change now. Maybe just a simple text. Maybe you can ask Jason to text one of your siblings about how this goes. Maybe you can text them about something positive if you don't want to burden them, but something small that they can do and they want to improve can go a long way. Okay, so just a few key takeaways that I want to share with you. First, everyone has resilience. Even for people have challenges to overcome the crisis, they have tried, they have resilience, they have things that they have done works for them. Sometimes we're not always aware of them. That's when the reflections can be so helpful. And sometimes we can do too much in one aspect of resilience and overlook other aspects. Are you too focused on problem solving, or you are too focused on problem distancing, or are you too focused on self-sacrificing? Are you not doing enough to focus on yourself and your relationship with others? And there are small things we can do to prepare for challenging times in caregiving. Even before the crisis come, we know that if Jason have a better relationship with people in the families, he might have more support next time when crisis hit. And again, resilience cannot solve everything. Care partners still face many unmet needs in current care systems. It requires care partner to have more to cultivate acceptance, compassion, and self-care. And also, we really have to expand resilience to resistance and advocacy for care partner. And for care partners, for care professionals in the room, I hope this talk can give you some idea to assess care partners' resilience besides their stress and burden. And service providers can assess care partner resilience, need to assess them comprehensively. If you see some care partner are so good at problem solving, probably need to check with them. Are you asking for help? Or how are you doing with your self-care? And early intervention to enhance resilience-related behaviors can be beneficial to prepare them. Support group and a lot of mutual support group, therapeutic group, self-care interventions could be really important for people to use even before they experience any crisis. And there's a need for innovative resilience enhancing interventions like mindfulness and compassion interventions. We can design support program from care partners' perspective and intervention that strengthen care relationships. Those are all important components of resilience. And care partners, especially those from underserved community, they still experience experience many unmet needs despite being resilient. And we should work together to addressing those unmet needs. I know it's hopefully to address a lot of challenges in the long term. And I want to share some additional discussions. It's a webinar that I was also part of, but there are also other experts who think a lot about resilience in dementia caregiving. And so you can hear more from another care partners and care agencies. I think, and this is some of the references. And I would like to open up the floor for any questions. And thank you so much for the active chat going on. I learned so much from you all.
Thank you, Dr. Zhou. That was wonderful, with such valuable information. And so if there's any questions, please either feel free to put them into the chat. You can raise your hand and I can take you off of mute. I do want to comment as we wait for people to put their questions in. The point about reflecting, it's so valuable. I think probably one of the hardest things for care providers to do is take the time to reflect on what happened, and see what could have been changed or what their takeaway is, how they feel about the event. But making sure they take that time for themselves to reflect is very important. We had a quiet group, then active, now they're quiet again. But again, does anybody have any questions for Dr. Zhou? So, okay, how do you work around caregiver resistance to self-care?
Yeah, how do you work around caregiver resistance to self-care? We have done a project trying to understand what all these facilitations and facilitating barriers for care partner to do self-care. There are so many reasons. I think one of the barriers I've seen is relating to the culture. For some people, they do not like the idea of self-care. As for them, they think this is selfish. It's not aligned with what they believe in. So I think that's also need to be sensitive for them. Also, is there anything, and so it's really about the language they use. I think I heard a lot of service providers saying, framing self-care in a way, say, oh, those are the things you can do so you can take a better care of your loved ones, and not just do it for yourself. That's a very common thing for people to do. For me, when we think about the resilience, it's about maybe asking about what are the things they have been doing. What are the small things they have been doing that has helped them during challenging times? It could be, is there any things they would like to keep doing? I think one of the self-care interventions I have seen, what the care partner wants to do is to drinking water, just to make sure they remember the drinking water, because sometimes she just gets so overwhelmed. And that's the one thing that she wants to be able to do it. But even just the small changes the care partner be able to do really changed her mindset. She realized that how important those, like she started to think about their own needs. Even the needs is just stay hydrated. So I think that's one of the things can get started. And another thing I want to, if I go to the slide, is all this behavior, they are related. A lot of times people do not have enough self-care opportunities. It's because they do not have enough support. They don't know about the resources, and they have central issues that make it difficult for them to do self-care. So just doing, also explore other things they have, the challenges they have encountered to do self-care can help with the resistance. Sometimes just find the right help, maybe a close friend, maybe a neighbor that they trust can stay here for half an hour, chat with a loved one, can be very helpful for that. Thank you for the question.
I think you did such a great job covering everything in your presentation. We may not have that many questions. So again, just a couple more seconds if anybody has any questions. Otherwise, we will wrap it up. Um, okay, wonderful. So thank you again, Dr. Zhou, for joining us today, and thank you all for joining. If you have any further questions or are looking for more information regarding resources that were talked about today, or if any resources in general for the Orange County area, please reach out to our helpline. The phone number is 844-373-4400. And please remember to complete the survey as you exit the webinar. That information is so valuable to us. So thank you all and have a great day.
Thank you.